If you follow the science of human metabolism, you're likely familiar with the current generation of weight management tools. We've seen a clear progression in how these compounds function. Medications like semaglutide operate by targeting a single hormone receptor. Tirzepatide took that a step further, targeting two independent receptors. These medications excel at quieting appetite in the brain, but they share a specific biological limitation. They're highly effective at reducing the energy you take in, but they lack a direct mechanism to actively increase the energy your body burns. Retatrutide addresses that limitation. It's a first-in-class triple agonist. This graph plots the phase 2 trial results that secured the medical community's attention. It tracks adults with obesity taking the highest dose over a 48-week period, showing an average body weight loss of roughly 24%. The most crucial detail is the angle at the far right of the chart. At the 48-week mark, the trajectory had not yet flattened out. The biological momentum was still driving downward. This multi-receptor approach requires specific education and strict medical stewardship. It's a new way of interacting with human biology. At the molecular level, retatrutide is a single peptide designed to switch on three of the body's own metabolic signals at the exact same time. The first lever is GLP-1. This is the signal that communicates fullness to the brain, slows the rate at which the stomach empties, and prompts the body to release insulin only when it's actually needed. The second lever is GIP. This signal sharpens your baseline insulin sensitivity, helping your fat tissue handle incoming energy much more efficiently. The third lever is glucagon, and this is the piece the previous generation of peptides lacked. Glucagon gently raises your resting energy expenditure. It encourages the body to actively burn stored fat, and it pulls excess fat directly out of the liver. Three independent biological levers operating across different systems, all driving a coordinated change in how the body manages energy. Because it engages those three signals simultaneously, the ongoing Phase 3 clinical trials are measuring endpoints far beyond the bathroom scale. This comparative bar chart tracks baseline liver fat in earlier study participants. By the end of the observation period, researchers recorded a drastic 80% reduction in liver fat. The scope of the research also extends to physical mechanics. Trial groups with obesity paired with knee osteoarthritis are being measured for reductions in joint pain, while other cohorts are being evaluated for improvements in obstructive sleep apnea. To capture the long-term systemic impact, the program includes a dedicated heart and kidney outcomes trial, actively enrolling roughly 10,000 people. The scale of these trials makes the objective obvious. Researchers are evaluating this compound as a comprehensive, system-by-system metabolic tool. Understanding a compound of this magnitude means detailing the side effects and the risks. The most frequently reported experiences are digestive, nausea, diarrhea, and occasionally vomiting during the early weeks. This is exactly why the protocol dictates starting at a low dose and raising it slowly. Rushing the dosage schedule is the single biggest reason patients feel physically ill. A newer signal documented in the data is dysesthesia, an unusual skin tingling or sensitivity, which appeared in roughly 1 in 5 people taking the absolute highest dose. Then there are the uncompromising medical red lines. Retatrutide is strictly forbidden for anyone with a history of medullary thyroid cancer or MEN2 syndrome. It must also be taken entirely on its own and never stacked with other drugs in the same class. Activating three powerful biological signals at once demands strict medical guardrails to ensure patient safety. Even with those guardrails in place, there's a physical variable you control entirely. A peptide lowers the number on the scale, but your lifestyle dictates whether that weight comes from stored fat or from lean muscle. Protecting that lean tissue takes intentional work, a high daily protein intake and consistent resistance training so your body keeps that hard-earned muscle. Minimizing side effects takes similar discipline, actively replacing electrolytes, prioritizing dietary fiber for steady digestion, and fiercely guarding your sleep to keep appetite signals regulated. One important note: retatrutide remains an investigational, Phase 3 compound. It's not approved for public use, and everything here is educational, not medical advice. So come sit with us. The door is open whenever you're ready, and wherever today takes you, stay humble, be kind, spread love, and pay it forward. Unless you're in a drive-thru, then pay it backwards. Bless up.